Good afternoon, everyone. Welcome to Yashoda Hospitals webinar series. Today we're covering a very important topic, insulin therapy and insulin delivery devices. As we all know, insulin is very high important drug. It is also called as emergency drug, and it is everyone should know, especially nursing, how to administer the insulin to the patients. They should know basics of insulin therapy. What are the different varieties of delivery devices are there? Today we are covering contraindications and indications of insulin therapy, types, site, and routes, insulin dosage, complications, and nursing management. We are focusing more onto the nursing day-to-day activities, how they are going to focus and how they are delivering the care to the patient in proper way, how to optimize the better sugar controls, and how they can get the desired result. So I am Dr. Amarnath Birada, Associate Vice President at Yashoda Hospital. Today, we got to manage our renowned consultant, Dr. Raman Bodula. He is one of the expert panel today for today's webinar. He is consultant endocrinologist. He is working with since long time, more than 2 decades. He is having vast experience on today's topic. I'm talking about delivery devices, insulin therapy. I welcome Ms. Sushma. She's nurse educator. She is working since long time with us, associated with us. Ms. Sushma, please start the webinar. Then after that, we'll have a discussion with Sir about overview on that 5 minutes in the final.
Good afternoon, all. So I thank Amar sir for giving me this opportunity. So today, diabetes is all about insulin levels and sugar levels and what you put into your body. So as a nurse, we play a very, very important role. So as a nurse, we also need to know the insulin therapy, like how it will be delivered and what are the different types of insulins and what are the indications, contraindications for insulin therapy. Because insulin is one of the high risk medication. As we consider, insulin is one of the high risk medication. That's the reason we need to know the different types and sites and also the nursing management of insulin therapy. So before going to that, let us know what is so I'll just brief you about the insulin therapy. What is insulin therapy and its delivery devices, the indications and contraindications, types and sites and routes, insulin dosage and complications, and finally nursing management. So before going to insulin therapy, let us see the normal insulin mechanism and the person who is having diabetes. So if we look into the normal mechanism, so here what happens, the pancreas, from the beta cells from the pancreas, which will secrete insulin. So this insulin, it will circulate into the blood and it will carry throughout our body. So during this process, this insulin will reaches to the receptor site. So from there, the glucose is stimulated. So this glucose will enter into the cell and from there the energy is produced. So this is the normal insulin mechanism. But when we look into the person who is having diabetes, so here the glucose will not enter into the cell. That means the cell is resisting the glucose. So this is what it happens in the person with diabetes. So who are all required this insulin therapy? If we look into that, then the person with type 1 diabetes, the next type 2 diabetes, gestational diabetes, diabetic ketoacidosis, and insulin resistance. So first coming to type 1 diabetes, here what happens? The pancreas will fail to produce insulin. That means the glucose is not getting absorbed. And also we all know that type 1 diabetes is insulin dependent diabetes. And next coming to type 2 diabetes, where the insulin is released and cell fails to respond to insulin properly. And next coming to gestational diabetes, during the pregnancy, the mother cannot make adequate amount of insulin. So that is called gestational diabetes. And diabetic ketoacidosis. So here in blood, the acid levels will be increased. That is called ketones. And the next, insulin resistance. As we have seen, the cell will not allow the insulin glucose to get into the cell. So it will try to reject it. That is called insulin resistance. So these are the few indications for insulin therapy. And there is no exact contraindication for insulin therapy. But as we move on, like the person who is having renal impairment and liver failure, for them we need to be very cautious. So continuous monitoring should be there. Why? Because the liver acts, the liver will play a very important role. Like it will help us in metabolism, and it is excreted through urine. So these are the few contraindications, but there is no exact contraindication. And let's move on to the next thing. So here, if we look into the blood glucose levels, here I display there are different blood glucose levels. So like FBS, RBS. FBS is fasting blood sugar levels, and RBS random blood sugar levels. These are the normal and abnormal values. And later we have one more blood glucose level, that is HbA1c. HbA1c is nothing but glycolated hemoglobin. So this is just in the person we can monitor minimum approximately 3 months of blood sugar levels. That is HbA1c test. So these are the normal values. If you want to take a screenshot, you can take a screenshot of it. Next, there are different types of insulins. So first, coming to rapid insulin. The name itself tells us that rapid insulin is nothing but fast acting insulin. So here what happens, these are the few medications which fall into the rapid insulin medication. So first, rapid means as soon as you administer the insulin to the patient, here what happens, the action will be starting within less than 15 minutes of time, and the peak will be around 60 to 90 minutes. That means the more effect will be during 60 to 90 minutes, and it will last for, the duration means it will last for 3 to 5 hours. So, and the next injection should be, this insulin should be given before mealtime. That means minimum of 10 to 15 minutes priorly. And the next, if we move on to short acting, so short acting is nothing but the onset is 30 to 60 minutes, and the peak time is 2 to 5 hours, and here the duration will be for 6 to 8 hours. So this medication to be given to the patient before mealtime, that means 20 to 30 minutes priorly. And if we move on to the intermediate, there are two different medications which fall into intermediate. That is the onset is different, the peak time is vary, and the duration also is varying. But nothing here, it will be lasting for 24 hours. So commonly used twice daily, and it is also combined with rapid or short acting insulin. And the next, long acting insulin. The name itself tells us that it will act more than 24 hours in a day. That means 24 hours continuously, the action will be there. And the next, pre-mixed medication. That means it is the medication is combined with intermediate and short acting insulin. Commonly, this medication is used twice daily before mealtime. So these are the few different types of insulins. If you want to take a screenshot of it, you can take it. So I'll just move on to the next slide. So there are different insulin doses. The first one is bolus insulin, and the next basal insulin. Bolus insulin is nothing but it is quick acting. So as soon as we give the medication, the action will be very quick, and this is taken before the mealtime. So there are few examples in bolus insulin, that is Novolog and Humalog. So these two medications will fall into the type like rapid and fast acting insulin. So next, if we move on to basal insulin, this is long acting insulin. It will act near about 24 hours in a day, and there are two types which fall into the basal insulin, that is intermediate insulin and long acting insulin. Whereas coming to intermediate, NPH is the example, and long acting, it is Lantus. So these are the different doses of insulin, that is bolus and basal. So we have different sites. As we all know, the insulin will be administered in different sites. So there are few common sites like upper outer arm. So upper outer arm, abdomen, buttocks, and upper outer thigh. So if the person wants to go with the self-medication administration, then they can go for the abdominal and upper outer arm. So these are the sites which will be flexible for them. And there are different delivery devices and methods of insulin administration. So let us look into different delivery devices. They are like insulin inhaler, insulin pen, insulin syringe, and insulin pump, and insulin infusion. So these are the different devices which we use to deliver the insulin. So first, if we move on to insulin inhaler, so this inhaler, as soon as the patient inhales the insulin, it directly enters into the lungs, and it will deliver to the blood, and there will be rapid action. And the next, insulin patch, this is very rarely used, and the delivery will be little bit slow. And insulin syringe, this is what we commonly use. So here we generally use 40 IU and 100 IU insulin syringes. So let us know what is the difference between 40 IU and 100 IU. So here 100 IU is 2.5 times greater than 40 IU. So Whenever you're choosing any 40 IU syringe, then you always need to choose 40 IU insulin vial. And if you're choosing 100 IU syringe, then you always need to go with the 100 IU insulin vial. So next, coming to insulin pen, as you all know, this is very flexible for us and easy to use, and there is not much pain also. So next, coming to insulin pump, there is nothing much. Actually, this insulin pump is very rarely used. So what happens here? A cannula is placed into the patient's abdomen, and this monitor is connected to the abdominal area. So where we can continuously monitor the delivering of the insulin. And the next, insulin infusion, this is commonly we can see in all the ICUs. These are the few common delivery devices and methods of insulin administration. So as a nurse, we play a very, very important role in delivering the insulin medication. So first, let's look into the different nursing checks. Actually, first thing is like whenever we're going to administer insulin, first and foremost thing is like we need to check the doctor's prescription. And the next, identify the patient. So patient need to be identified by two methods, the patient's name and patient ID band. And the next, follow triple check. So what is triple check? Triple check is nothing but when you're procuring the medication from the pharmacy and before loading the medication and before administering the medication. So these are the three checks before giving insulin. And the next, followed by right assessment. As we all know, whenever we are giving all the high risk medications, we always follow 10 rights of medication. In that 10 rights, the 8th right is right assessments. So whenever we are going to give insulin medication, so always we need to check patient GRBS levels. That is called right assessment. And the next, moving to, we always need to refrigerate the insulin medication. So the fridge temperature should be maintained around 2 to 8 degrees centigrade. So these are the very, very important nursing checks which we need to follow in our day-to-day life. So there are also do's and don'ts. So first, let us look into do's and don'ts. So first to do is gently rotate the vial. So always, whenever you're going to deliver the medication to the patient, so whenever you're taking the medication from the fridge, always rotate the medication in between your palms to get into the normal room temperature. So next, followed by, leave the needle at a place for 5 to 10 seconds. Why? Because for effective delivering of the medicine. So as soon as you push the medication into the patient's body, you need to wait for 5 to 10 seconds. Just follow the counting method. And the next, rotate insulin administration site. So whenever you're giving insulin to the patient, you always need to rotate the site. That means never ever follow the same site injection. So you need to rotate. You can use, there are many methods to follow. So you can use your palm, you can use your clock, weekwise, or else always from the navel, the injection should be given either 5 centimeters away or 2 inches away from the navel. This method you need to follow. And the next, coming to don'ts. You never ever shake the medication vigorously, and the rapid infusion technique should not be followed. Always follow the slow infusion technique, and you should never massage the injection site. This will, what happens during this time, it will affect, immediate action will be there. So these are some of the do's and don'ts of insulin therapy. So there are like complications like lipodystrophy. As I discussed before, if we give the medication at the same time, then there is a chance of lipodystrophy. Here you can have a look. So you can follow a finger technique method. From the navel, you need to maintain 5 centimeters or 2 inches difference, and you always need to change the injection site. And this is a weak technique. So these are the different techniques to prevent lipodystrophy. And the next complications are hyperglycemia and hypoglycemia. Hyperglycemia is if the blood sugar levels are more than 180 mg per dl, and hyperglycemia is less than 70 mg per dl. So these are the few complications for insulin therapy. And now it's the time for quiz. So let us see the first question. So this is our first question. I'll just read out for you. Anaya, a 15-year-old patient, was newly diagnosed with diabetes type 1. She is on regular insulin. If she is prescribed to have a daily shot of insulin every 8:30 a.m., when would be the appropriate time that she should have her meal? So whatever the answer, here are the answer options, like option A, B, C, and D. So whichever the option you feel it's correct, you can drop it into the chat box. So Anaya is diagnosed with type 1 diabetes. So she's on regular insulin administration, and she need to take her daily shot at every 8:30 a.m. So what would be the time, like appropriate time that she should have her meal? Is it 9 a.m., 11 a.m., 12 noon, or 1 p.m.? So you can drop your answer in your chat box. So where will the, okay, so the answer is 9 a.m. because the onset of regular insulin is 30 to 60 minutes. So Anaya should be able to eat by the time to avoid hypoglycemia. So this is what the answer, that is 9 a.m. So to prevent hypoglycemia, she need to take her meal at 9 a.m. So let us see the next question. All of the following nursing interventions are needed for the patient taking insulin. Except from this, what is the answer? So option A is refrigerate insulin at 2 to 8 degrees centigrade. Combined insulin should be administered within 15 minutes. Rotating injection site, vigorous shaking of the vial. So whichever the option you feel that is exceptional, you just type it in the chat box. So all of the nursing interventions, which is not acceptable, that you need to type it in the chat box. So let us see the answer. So option D is our answer. That means we should not, like vigorous shaking of the vial is avoided. Okay. And the next, let us look in third question. A diabetic patient receiving insulin is in need of an antihypertensive. So the patient is on antihypertensive medication. Which of the following would be the least recommended in the following choice? So is it a propranolol, enalapril, hydrochlorothiazide, and nifedipine? So these are the few medications. You can type it in the chat box. Now the patient is in need of literally antihypertensive medication. So which of the following would be the least recommended in the following choice? So which medication we should be very careful when the patient is on antihypertensive. So our answer is propranolol, because this is the beta blocker. It is given in the patients with antihypertensive. So it is also, it blocks a signs and symptoms of hypoglycemia. The signs and symptoms will be as same as hypertensive patients. So we need to be very careful. And the next, we'll move on to the last question. Which insulin should never be mixed? So is it rapid acting insulin, short acting insulin, intermediate acting insulin, and long acting insulin? So these are the 4 options for your insulin should never be mixed. Shall we look into the answer then? Okay, so our answer is D. Long-acting insulin cannot be mixed in the same syringe with other insulin because this could change the insulin mechanism of action. So this will change the mechanism of action. This is our answer. Okay, so this is the take-home message. Today I'm going to give you good glycemic control is essential in reduction of micro and macrovascular outcomes, and combination therapy is often necessary. And starting insulin early is safe and effective to prevent further complications.
Thank you, Sushma. You've done excellent presentation. So, anything you want to say, Sushma?
Yeah, I just wanted to share 2 videos, sir. So how to deliver the medication, like 2 methods, syringe method and insulin method.
Go ahead.
So always you need to follow a 90 degrees angle when you're delivering the medication. It's not mandatory that always it's 90 degrees to like 45 degrees. So the patients who are well built, so for them you can follow 90 degrees angle. If you take abdominal side, always you can give the medication in 90 degrees angle only. And if you go with the upper outer arm, if the patient is very lean, very thin, then you can go with 45 degrees angle. In case of syringe, pen, always you go with 90 degrees angle, and after injecting medication, you always need to wait for 5 to 10 seconds. So this is how you need to use a pen. 90 degrees angle. After injecting the medication, you have to wait for minimum of 5 to 10 seconds. So this is how you need to deliver the these are the 2 techniques which we commonly use in our daily life, that is syringe method and pen method.
Okay, excellent. Sushma, you've done excellent presentation.
Thank you,
So
sir.
I would like to request our Chief Consultant, Endocrinologist, Dr. Ramana Budla, sir, please give your overview overall on like how important for a nurse knowing the insulin therapy and delivery devices, how it gives the impact on clinical outcome if they know better way. Please, sir.
Thank you, Dr. Ahmad, for inviting me as expert panelist. Congratulations to Ms. Sushma for delivering an excellent presentation covering all aspects of insulin. So insulin, as we all know, is really a boon to the management of diabetes without which it is very difficult to manage insulin. So before 1920, when it was discovered first time insulin, lot of thousands of patients used to die because of lack of effective medicine. But once the insulin was invented in 1920 by Banting and Best, so a lot of millions of patients were saved and are being saved now also by using insulin effectively to manage the diabetes. So insulin is definitely a boon, and at the same time, as Ms. Sushma mentioned, it is a high-risk medicine because it can save the life by controlling the hyperglycemia, any amount of hyperglycemia, because it's the most potent drug available in the management of diabetes. So it can control any kind of severe hyperglycemia, severe diabetes, and save the life of the patient. But at the same time, if it is inadvertently administered to a wrong patient or a wrong dose, it can cause death to the patient by causing severe hypoglycemia. So that is why it is regarded as high-risk medication. So as a nursing personnel, you are supposed to know each and every aspect of insulin because it is a high-risk medicine, so that you can use it cautiously, effectively in the management of patient care. So most important uses for insulin is in the inpatient management because the nursing staff is involved actively in the management of inpatients. So a lot of inpatients now, because the prevalence of diabetes is increasing across the world, majority of hospitals, everywhere, the majority of admissions, the inpatient admissions, most of the patients are having diabetic patients because diabetics are having increased chance of infections, increased incidence of complications like any kidney complications, heart complications, stroke complications, and infections. So because of any specialty, if you see the admissions, majority of the patients are of diabetic. So you have to be prepared and you have to develop your knowledge about the using insulin, because for inpatient, practically for every patient, we use insulin only because we cannot use oral tablets in inpatients for management of diabetes because we cannot titrate the dose of the tablets as we do with insulin, which is very simple, very easy to titrate the dose of insulin to control the blood sugars, because blood sugar control is very closely related to the outcomes of the patient, because patient has to improve the original problem for which the patient has been admitted. It depends on his blood sugar control status. Unless you control the blood sugars effectively, the patient will not recover from his original condition for which he came to the hospital. For example, infection, unless you control the diabetes, the recovery from infection is very difficult. Similarly, recovery from the hospital, the surgery, the major surgeries happen like bypass surgeries, replacement surgeries, transplantation surgeries. All these surgeries, they involve a lot of stress to the patient and they cause hyperglycemia, very severe hyperglycemic peaks in the patient. So insulin is the only effective drug in such situations to control hyperglycemia and manage diabetes and improve the patient outcomes. So that is why you are supposed to know everything. I think Ms. Sushma has explained everything in detail, the various types of insulins, the rapid acting, short acting insulins, intermediate acting and long acting insulins available and in tabular form, and what is the duration of action and how quickly they start their action. Everything she has explained, and the various insulin regimens also she has explained, like basal and bolus regimens. So bolus means before each meal we give bolus insulin, and basal insulin we usually administer at night to control the fasting blood sugar. So combination of both bolus and basal insulins are used to control the overall hyperglycemia in patients with diabetes, particularly in patients. And again, she has explained the one important practical point, which everybody has to know, the nursing personnel, because she has shown there are two kinds of syringes. There are two kinds of syringes available, 40 IU syringe, 40 IU per ml and 100 IU per ml. Similarly, we have two strength bottles, the vials. So 40 IU bottles and 100 IU bottle. So you have to know that we have to use the syringe with the corresponding bottle only. For example, most commonly we use 40 IU bottles and 40 IU syringes. But some patients who require very high dose, like each time some patient require 30 to 40 units each time. So overall in a day, they may require 150 units. So for those patients, we rarely use this high strength solution like 100 IU bottle and 100 IU syringe. So the nursing personnel should not confuse between the two. So they should remember, you all should remember that the number, the syringe number should coincide with the number written on the vial. So 40 IU syringe has to be used with 40 IU syringe. On the other hand, if you confuse and mix it and use 40 IU syringe with 100 IU bottle, that means you are injecting 2.5 times higher dose to the patient. So which will put the patient at risk of severe hypoglycemia, and it may cause death also. Because in cardiac patients, if you produce hypoglycemia, it can cause cardiac arrhythmias and death of the patient, which is a very important thing to know. So this is very practically important point, as she highlighted that. So you all should remember this. So always check when you are using the vial and syringe, because most of the patients, in majority of patients, we will be using vials and syringes only. For some affordable patients who are admitted in private wards, we usually use the pen devices, which are very simple. You can just dial the number, and as she has shown, it's very easy to use and very easy to use the pen devices. But when you are using majority of patients, the syringes and vials, you have to remember this practical aspect. You have to cross-check. And she has also highlighted the triple check method and the right assessment. They are very, very important practical points to know on part of every nursing personnel. So that it will help them to avoid unnecessary mistakes. Because if you are doing a mistake, you are putting the patient at danger, because it's a high risk medicine. So that is the importance of understanding and knowing all aspects of the insulin. And she has beautifully explained the types of the administration technique and sites of insulin injections and the rotation of insulin sites, which is very, very important to avoid complications. Because if you go on picking the same site, you'll be producing lipodystrophy. And from that site, if you're injecting insulin, it will not be absorbed properly. There may be erratic absorption of the insulin if you are injecting in the same site. So that is putting the patient at very severe hyperglycemia or severe hypoglycemia. So rotation of injection site is very, very important to know and remember and practice that. So various types of insulins, the pen devices. We are using now more commonly the pen devices, because patients' affordability is increasing across the world. So we are able to use these pen devices very frequently in many patients. So you all should know the what is a which pen has to be, because many companies are producing these pens basically. So every pen will fit the cartridge manufactured by that company. So you should not again mix the cartridges with the pens. So that also is important practical point. So the one particular brand has a pen dedicated to that brand. So you should not mix the pen device with other cartridges. This is another important practical point. So knowing the various types of insulins, various insulin regimens, and the injection, the syringes versus pen devices, and the importance of insulin injection technique and rotation of the sites of injection, and the how to uh, store the injection. So these are the very important practical points for every nursing personnel to know and practice that in your regular practice. So that will improve not only the patient care, but also it will help the doctors also to mediate the corrective effective treatment to the patient, so that ultimately we all are working together. The doctors and nursing personnel are working together for the betterment of the patient. So if there is proper coordination between the doctor's instructions and the nursing personnel is following them meticulously, this will obviously help the patient, improve the patient outcomes. So that is the most important motto in the patient care in every hospital. So thank you for giving me this opportunity to give my opinion on this talk. If there's any question, we can take.
Shushma, any questions are there down? You can discuss, sir, is there to this thing. And for all the audience who are reviewing this webinar today, please put up your questions. We are always available, not only during the live session, post session also, you can put questions we are ready to answer. And we'll take specially inputs from our expert panelists. So, sir, thank you for coming for the today's webinar. and your review was very excellent for the nurses to handling patient day to day in diabetic care and for better clinical outcome. Sushma, anybody is there having any questions?
No, sir. No questions, sir.
Okay, thank you, sir. Thank you, Sushma.
Thank you, sir.
Thank you, Dr. Ahmed. Thank you, sir.